Well, you can add the Eiffel Tower of Paris to the list of places that go pink to raise awareness of breast cancer. And this makes it official. The Pink October campaign has reached international status.
Back here at home, you can see the Vice President's home also went pink for breast cancer awareness. Dr. Joe Biden tweeted this photo of one of the anchors at the Naval Observatory.
The White House got into the pink spirit as well to show its support. By the way, regardless of where you stand politically, the President's Affordable Care Act has been credited with making breast cancer screenings possible for people who may not have been otherwise covered. The program has altered many insurance programs to allow for mammograms without deductibles or co-pays. So there is no question, mammograms save lives when it comes to breast cancer.
But for this next woman we want to introduce you to, it wasn't a mammogram she's crediting for saving her life, but a post on Facebook.
Leah Dietrich and Susan Knorr are neighbors and have been friends for many years.
Oh, remember that's the night we came to your cabin?
July 6th. And when they aren't able to hang out in person, their friendship continues online through Facebook, a social networking website.
Yeah, I haven't looked at this stuff forever.
It allows Leah and Susan to share pictures with one another.
See, I did all kinds of crazy experimentation with my hair.
Or share cooking recipes with one another. Facebook gives Leah and Susan an opportunity to share big moments in each other's life.
There's just so many.
But there is one moment in particular. It was total serendipity, total luck, that saved Susan's life.
My journey began through Leah's journey.
It's been a little bit more than 4 years since I was diagnosed with breast cancer.
After a long road of surgery and chemotherapy, Leah beat cancer and is now cancer-free.
I was just grateful.
Grateful enough to say thank you.
And so it just hit me that day of my anniversary. I thought, you know, I should just put a shout out to everybody on Facebook for all the great support and love and everything that I felt.
The Facebook post reads, "It was 2 years ago today that I was diagnosed with breast cancer. I want to thank everyone who helped me get through the ordeal that is cancer and its treatment. There were days I didn't want to keep going, and you all made me get up off my butt and do what I needed to do. Thank you."
I got Leah's gratitude and thankfulness for being kind of through it, and somehow I read between the lines. It didn't say anywhere about doing a self-exam, but that's what I got from that. That day, I did a self-exam, and I hadn't done one for years, maybe ever. And I felt a tumor, and I'm like, oh my God. Oh.
Just weeks later, Susan was diagnosed with breast cancer.
I had to tell her, this is so weird, you know, that because you put that on there, I found my cancer.
I'm a little bit more, I don't know if the word is private, but I don't post a ton on Facebook. But that one day of me just putting it out there for the world, you know, was enough to do that. And I'm really glad I did.
It turns out for Leah and Susan, Facebook isn't just for posting goofy pictures or sharing food recipes. It's also a place to offer encouragement and support.
On Facebook, with every posting that I put, there's all this love and support coming through saying, we gotcha, we're here for you, or we're supportive. And it's incredibly helpful.
I was just grateful that I could be one of those people for Sue.
Susan and Leah are both cancer-free and continue to share their stories on Facebook, hoping to encourage others to do self-examinations more often.
Now, fortunately for Susan, she felt the lump. She knew what she needed to do. Others, however, aren't so lucky, particularly those who think they're immune to the disease. The next man we'd like to introduce you to knows all too well about that, and now he is in the fight of his life.
Kind of felt a little bit of a lump just above the nipple on the left side of my chest.
Mike Salzman says he just finished jogging when he realized something was wrong, something he never imagined: breast cancer.
It moved to stage 4, which means the cancer has metastasized to other organs in the body.
Mike, like most men, had no idea he could even get breast cancer. But health officials say an estimated 2,300 men in the U.S. are diagnosed with it each year, and about 450 men die from the disease.
I'm going to die from the cancer. I know that, but there's no time frame for it.
His wife, Kara, is a breast cancer survivor. Together, they're battling this disease and getting their message across.
I want men to know that they are susceptible to breast cancer It is not just a woman's disease.
In 2012, the Selzmans took their fight to the Massachusetts State House and were able to get the third week in October designated as Male Breast Cancer Awareness Week.
The men have to know that it can happen. You know, pay attention, try and catch it early. I want people to get ahead of where I was when I found out, and have a better chance to live longer.
We deal with this together, and we would much rather laugh than be sad. And we take each day as it comes, and we fight every day.
A husband and wife going through it together. Isn't that incredible?
That really is incredible.
It's amazing. Now, Mike urges other men to be familiar with their family history. That's a risk factor for men developing the disease. He also urges us men to really know our bodies and to do self-checks.
Absolutely. It's so easy. Well, most people who are diagnosed with breast cancer choose to have surgery, and we touched on this earlier, and as with most surgeries, there is a recovery process.
But it's important to know there is therapy post-surgery that can help you fight your battle and get you back to your normal self. So, joining us today to tell us more are occupational therapist Sally Hawkins and physical therapist Dominique Duchateau, both with Atlantic Physical Therapy. Ladies, thank you so much for joining us.
Of course.
Yeah, thank you.
Okay, so Sally, we've established this isn't just a woman's disease.
No, we've seen men and women in the clinic for breast cancer rehab. We do feel it's very important that men, like you were saying, do their self-checks. It's so important because men are being diagnosed, you know, it is 1 out of 1,000 versus 1 out of 8. But we do see more and more men with breast cancer and
it does
coming
happen.
in for therapy. Yes.
Yeah, okay, so maybe a lot of people don't realize that occupational and physical therapy is a part of treatment for many people after breast surgery. Tell us why and how.
After breast surgery, common symptoms include decreased range of motion. They might have increased joint stiffness, or they might have pain and chest wall tightness. So our goal in therapy is to help individuals restore their functional mobility in their arms so that they can return to their everyday activities, such as being able to return to work, take care of the children, return to their hobbies of interest.
And you say the sooner you get them, the better. Why?
Yes. We find that if you start early intervention of therapy, you can help to prevent long-term complications. We'd much rather see somebody come within a couple weeks of therapy with limited range of motion, let's say to here, versus 6 months from now.
Right.
Then we can regain that motion much faster.
Okay, so let's talk treatment. It really isn't a one-size-fits-all. It really depends on what kind of surgery the patient has.
Yes. When a patient comes in, we do a full evaluation. We look at their range of motion, their pain, their soft tissue integrity, and we also look at what kind of surgery. Did they have a lumpectomy, for example, versus a modified radical mastectomy? Do they have chemo or radiation? So those factors might influence how we do our exercise program.
And you've got some exercises to show us for how this works.
Yes. We have different phases. Phase 1, we usually do the first couple 5 to 7 days of exercises, and we're very careful with having people work on their posture, as well as just simple shoulder exercises out to the side, out in front, in back. We also incorporate the ball. We might have people work on some ball stretches out to the side, out in front.
And these are, and like you said, they're not one size fits all.
Absolutely.
It just really depends on
the surgery.
Yes, and then we also use a cane. We might have somebody work on bringing the cane up to work their shoulder, maybe side to side in order to work their trunk.
Right.
And then we incorporate also elbow to hand exercises to facilitate that fluid circulation and flexibility.
Dominique, let me ask you this. There's another complication post-surgery that we've got to watch out for.
Yes. It's called lymphedema.
Okay.
And what happens is all of the fluid in your arm drains into the lymph nodes up in your armpit area. So what happens surgically when they remove those lymph nodes and also do radiation, the fluid in the arm doesn't know where to go. So it kind of gets stuck. So the treatment program that we offer is comprehensive. It includes a manual lymphatic drainage, which is a very specific type of massage.
Okay.
And then we also incorporate what we use, it's called a lymphedema pump. Okay, and that is, I'll show you. It is an arm sleeve that goes on, you put your arm in here. This goes around your trunk, okay? And then this gets hooked up to a machine that inflates and deflates with air. So it's pumping the fluid up into your axilla area. Then we follow the third part of that is using a compression sleeve,
Right.
and a gauntlet for the hand.
Okay.
And this can happen any time after surgery, even 20 years later?
Exactly. We've had ladies who have had post-mastectomy, no complications whatsoever, and then 20 years down the road, they get on an airplane. That reduced cabin pressure can actually stimulate the lymphedema.
Wow.
So all of this is different for everyone. Be sure to check with your doctor, but the big thing here is education.
Yes.
Be informed.
Be informed.
Yeah. Thank you so much, ladies.
Thank you.
Thank you
very much.
so much.
And if you would like to read more from Atlantic Physical Therapy about services provided, go to WBOC.com and click on our picture at the top of the page. And the healing doesn't stop there today. For the millions of stroke survivors, burn victims, and arthritis sufferers who have trouble with their hands, there's hope through this glove. It's a healing glove, and it's all made possible through cutting-edge technology. Up next, we'll hear how it works and find out how soon it may be available for patients.
And just, I heard a little pop noise.
He's not talking about his turbo. He's talking about his iPhone. This young man's going to tell us why he says it was too hot to handle and what Apple thinks about that. Delmarva Live will be right back.